Hi friends, now I'm going to explain you about the axillary artery. Axillary artery is the main artery that you will be seeing in upper limb. This axillary artery is the continuation of subclavian artery. Subclavian artery, after the first rib, it forms the axillary artery. So what does this axillary artery do? This axillary artery, it passes behind the pectoralis minor, and then it means first, let me show you by drawing it. So first, this is the subclavian artery. This thing which you will be seeing here, this is the subclavian artery. This is the first rib. After crossing the first rib, the subclavian artery tends to become the axillary artery. That is, it is a continuation. It's not a branch from subclavian artery, but it's just the continuation of subclavian artery. So it has formed like this. Okay, and now it runs downwards, and it runs. So now let me show you all this. What are these nerves and branches? I forgot to show you. So this is the first rib. Okay, this is coracoid process of scapula. And this, what is it? Coracoid process of scapula, which muscle is attached? It's nothing but pectoralis minor. And this is humerus. And this is bicipital groove. As you can see, this is medial. To the medial lip of bicipital groove of humerus, which muscle is attached? It's nothing but teres major. Okay? So it passes below the pectoralis minor, that is, it will be like this, below. And then again it passes downwards, and then it reaches the teres minor, and then after teres minor it passes over the teres minor, and then after crossing teres minor it continues to become brachial artery. Okay, what is it? Subclavian artery, then axillary artery. And this axillary artery continues to become brachial artery. All these are not branches, but these are just continuations. That is, the subclavian artery, after the first rib, it continues to become axillary artery. And this axillary artery, after teres major, after teres major muscle, after the lower border of teres major muscle, it continues to become the brachial artery. So now, this axillary artery is divided into three parts. What divides the axillary artery into three parts? You can easily guess by seeing this diagram. It's nothing but the pectoralis minor. This pectoralis minor muscle divides the axillary artery into three main divisions. This is first part. First part is here behind the pectoralis major. Above the pectoralis major. And the second part is behind the pectoralis major. See, pectoralis minor muscle, it's just my pectoralis minor. This pectoralis minor muscle covers the second part. So this second part, and below the pectoralis minor downwards, then this is the third part. So now this axillary artery is now divided into three parts. So I'm just drawing branches of axillary artery clearly, so that it will be useful to you. So axillary artery is first, as I said, it's divided into three parts. First part, second part, and third part. So it's easy to remember. From the first part, only one artery forms, that is superior thoracic artery. And from the second part, there will be two arteries which forms, that is thoracoacromial artery. Here A means artery, and the second branch is long thoracic artery. And from the third one, three branches develops. One is anterior circumflex humeral artery, same posterior circumflex humeral artery, and then a subscapular artery. So it is a tree for axillary artery. So from axillary artery, there will be three parts: first part, second part, and third part. From the first part, there will be development of superior thoracic artery. From the second part, there will be development of thoracoacromial and long thoracic artery. From the third part, three branches arise. They are anterior circumflex humeral, posterior circumflex humeral, and subscapular arteries. Okay, now you'll be seeing those branches first. So this is the first part. So from the first part, first artery which develops is superior thoracic artery. So this is the superior thoracic artery. It runs downwards and then it supplies pectoral muscles. It runs downwards and then it supplies pectoral muscles. What is it? Superior thoracic artery. And then this is the second part. So from the second part, there will be development of two arteries. One is thoracoacromial artery and the second one is lateral thoracic artery. You can see here, thoracoacromial and lateral thoracic. Lateral thoracic artery. Okay, thoracoacromial artery, it first emerges at the upper border of pectoralis minor here, and then it divides into four branches. One is pectoral branch, which supplies the pectoral muscles, has just like superior thoracic artery. And the second branch is deltoid branch. It goes and supplies the deltoid muscle. Okay, and the third branch is acromial branch. As you know, in this clavicle, in the scapula, there is a process called as acromion process. It supplies the acromion process, that is third branch, and the fourth branch is clavicular branch. It supplies the clavicle. So here, thoracoacromial artery again has four branches. Easy to remember is A, P, C, D. Not A, B, C, D, but it is A, P, C, D. This is acromial branch, pectoral branch, clavicular branch, and deltoid branch. So all these four are the branches of thoracoacromial artery. So here the thoracoacromial artery. So this is the thoracoacromial artery. So the acromion branch of thoracoacromial artery goes to the acromial process, and then this is the acromion process, right? And then it participates in the anastomosis around the acromial process. So you'll be dealing it in the next part of this lecture. And then that is thoracoacromial artery. The next artery which you'll be seeing is, what is it? Lateral thoracic artery. Lateral thoracic artery, it emerges at the inferior border of pectoralis minor. So this is pectoralis minor, inferior border is this one. It emerges here, inferior border of pectoralis minor, and then it goes downwards, and then it supplies the pectoral muscles. And this most important part of this lateral thoracic artery is that it supplies the mammary gland. The mammary gland. This lateral thoracic artery gives branches to the mammary gland. So as a result, the main clinical aspect is, in females, lateral thoracic artery is well developed. In females, this lateral thoracic artery is very well developed. So this is the lateral thoracic artery. You can see here. It goes downwards and then it gives branches to the pectoral muscles, and then it comes downwards, and then it also gives branches to the mammary gland. So it is well developed in females when compared to males. So now superior thoracic completed, thoracoacromial, lateral thoracic completed. The next one is anterior circumflex humeral, posterior circumflex humeral. So first let's come to the anterior circumflex humeral. It is a branch from the third part of axillary artery. So it passes in front of the seat. It comes like this. It passes in front of the surgical neck of humerus, and then here it anastomoses with the posterior circumflex humeral artery. Okay, and then it also gives an ascending branch to the humerus, and thus it supplies the head of the humerus. So this is anterior circumflex humeral artery. So you can see it emerges from the third part, and then it runs around the surgical neck of humerus, and then it anastomoses with the posterior circumflex humeral artery. Then it gives a branch to the head of humerus, so that it helps in the supplies the humerus. And then posterior circumflex humeral artery is the second branch of third part of axillary artery. So the posterior circumflex humeral artery, it emerges from at the same point but a little backward of the axillary artery, and then it passes behind the surgical neck of humerus, and then it anastomoses with the anterior circumflex humeral artery. And the main thing of this posterior circumflex humeral artery is that it passes through the quadrangular space. So what is quadrangular space? This quadrangular space, you will be dealing it in the next class mainly. So this quadrangular space, it passes through the quadrangular space. This quadrangular space, let me explain you briefly about the quadrangular space so that you can understand it. So this is humerus. From the humerus, and this is scapula. There is long head of triceps, this one. Okay, and there will be teres minor and teres major. Yeah, so here you can see this is the quadrangular space which is formed. So this quadrangular space, it is formed above by the teres minor, below by the teres major, medially by the scapula, lateral border of scapula, and laterally by the long head of triceps. So through this quadrangular space, which is here, it passes through this quadrangular space, and then it goes backwards. It winds around the surgical neck of humerus, that is backwards, posteriorly, and then it anasmoses with the anterior circumflex humeral artery. So here is the anasmosis, which you can see here. So this is posterior circumflex humeral artery. Now the next one is subscapular artery. Subscapular artery is the largest branch of this axillary artery. So now this emerges from the third part, and then it runs downwards. So you can see this. This is subscapular artery, and then this subscapular artery, it runs around the lower border of subscapularis muscle, and then it ends near the inferior angle of scapula. So it runs like this, and it ends in the inferior angle of scapula. But the main thing of this is it gives a branch that is circumflex scapular artery. See, this is the circumflex scapular artery. So this is the subscapular artery, and this is the circumflex scapular artery. This circumflex scapular artery passes through upper triangular intermuscular space. So what is upper triangular intermuscular space? See, this is upper triangular intermuscular space, which you can see here. This one. So this is bounded by surgical neck of humerus, long head of triceps, and teres major. So it passes here. So what do we see? What did we see? The circumflex humeral artery passes through the upper triangular space, and that posterior circumflex humeral artery passes through this quadrangular space. So subscapular circumflex scapular artery passes through the upper triangular space, and the posterior circumflex humeral artery passes through the quadrangular space. So this circumflex scapular artery passes through the upper triangular space and winds around the scapula, and then it enters the infraspinous fossa, and then it gives numerous branches. And then it also helps, it is also involved in the anasmosis, which occurs around the body of scapula, which we will be learning now. So all this is about axillary artery. So let me brief you the branches. At least I will show you the branches. So this is the first part. From the first part there will be superior thoracic artery. From the second part there will be thoracoacromial artery, which gives three branches. This is deltoid, deltoid, acromial, pectoral, and APC clavicular branches. And then from the second part there will be lateral thoracic artery, which is very prominent and well prominent in female because it supplies the mammary gland. And then from the third part there will be anterior circumflex humeral, posterior circumflex humeral, which passes through the quadrangular space. And then there will be the subscapular artery, which is the largest division of axillary artery, and this subscapular artery gives a small branch, that is circumflex scapular artery. This circumflex scapular artery passes through the upper triangular space. So this circumflex scapular artery passes through the upper triangular space. So and it gives numerous branches, and it enters this infraspinous fossa, and then it gives many branches. So all these are the axillary artery. And then what are the anastomosis around the scapula? So now what you have to see is the anastomosis around the scapula. So let me draw. So this is the scapula. This total is the scapula. This is the acromion process. This is supraspinous fossa. This is infraspinous fossa. This is spine. So above the spine, supraspinous fossa. Below the spine, there will be infraspinous fossa. Okay. So now let you learn. First, this is the axillary artery, right? axillary artery, which continues as brachial artery. So this is acromion branch. First thoracoacromial artery. Thoracoacromial artery gives 4 branches, A, P, C, D. A, P, C, D. A1, which is acromial branch, it gives like this. Okay. And then anterior circumflex humeral artery. This is posterior one. So this is anterior one because this is posterior aspect, right? This is anterior circumflex humeral artery. This is posterior circumflex humeral artery. Posterior circumflex humeral artery also gives a branch to acromion end. Okay. And this is subclavian artery. As it is this is the continuation of subclavian artery, right? Axillary artery is a continuation of subclavian artery. So subclavian artery has a branch called, this is your new term, thyrocervical trunk. This thyrocervical trunk gives 2 branches. One is this one, which is suprascapular, and the other is this one, which is transverse branch of deep cervical artery. Okay, so first let me repeat it. Let me complete it and then I'll repeat. This suprascapular artery gives a branch to the acromion. So this is the acromial anastomosis around the acromion. So let me repeat. This is the axillary artery. Okay, axillary artery. From the second part of axillary artery, there is thoracoacromial artery. This thoracoacromial artery gives 4 branches: acromial branch, pectoral branch, clavicular branch, and deltoid branch. This acromial branch goes and forms the anastomosis around the acromion process. This is acromion process. And then from the third part of axillary artery, there will be anterior circumflex humeral artery and posterior circumflex humeral artery. Posterior circumflex humeral artery gives a branch, this branch to the acromion. This also participates in the acromial anastomosis. And this is the subclavian artery. Axillary artery is a continuation of subclavian artery. So the subclavian artery gives a branch, that is thyrocervical trunk. This thyrocervical trunk gives 2 branches mainly. One is suprascapular artery and the other is transverse branch of deep cervical artery. The suprascapular artery gives a branch to the acromion and thus it helps in the formation of acromial anastomosis. So 3 main arteries which form acromial anastomosis are acromial branch of posterior circumflex humeral artery, acromial branch of thoracoacromial artery, and acromial branch of suprascapular artery. And then around the body of scapula, this suprascapular artery, which is continuation, it forms anastomosis around the body of scapula, along with the deep cervical artery, which gives many branches, and thus this forms the branches of anastomosis around the scapula. And then a branch from the subscapular artery. Subscapular artery arises from the third part of axillary artery. This subscapular artery is the largest artery, as I said, and it gives a branch which is circumflex scapular artery, which passes through the upper triangular intermuscular space, and then it enters the infraspinous fossa. And participates in the anastomosis around the scapula. So this is the anastomosis around the scapula. So now you can see what are the arteries which anastomose around the scapula. The main thing is circumflex scapular artery, which is a branch of subscapular artery, which is in turn a branch of axillary artery, this anastomosis, along with suprascapular artery, which is a branch of thyrocervical trunk, and also transverse branch of deep cervical artery, which is a branch of thyrocervical trunk. So all these 3 arteries participates in the anastomosis around the scapula. So now a doubt. What is the need for anastomosis around the scapula? The main reason is, in our body there are many anastomoses. If there is a block in any one of the blood vessel, then that organ can be supplied by any other blood vessel. Because of this anastomosis, if there is a block, for example, if there is a block in circumflex scapular artery, so this part of scapula, for this part of scapula, there is no stoppage of blood supply. Blood is supplied through this suprascapular artery or transverse branch of deep cervical artery. So this anastomosis is mainly needed in order to allow the blood flow to an organ even if a blood vessel is blocked. So this is the end of the lecture about axillary artery and the anastomosis around the scapula. Okay then, bye.